Welcome to Beach Jam Media, your resource-driven oasis with your host, Jennifer Corbin Carson. Join us each week as we dive into hot topics and essential materials for individuals and businesses. We invite you to get your feet wet and explore life's offerings. From insightful discussions to practical advice, we're here to navigate the tides of change together. Come join us for Beach Jam Media, where knowledge flows endlessly and where the currents of insight never stop. So come on, let's get our feet wet and explore what's waiting for us on the beach.
Good morning. Glad you all are here today with us. On Beach Jam Media. So I'm your host, Jennifer Corbin Carson, and our mission is to bring you more resources to help you on your everyday life. But today I'm bringing you more of those resources directly from the VA. So grab your coffee or your favorite morning drink, or it's almost afternoon, but grab your favorite beverage and join us to see what we have for you today. After this.
Beach Jam Media is your resource-driven oasis, hosted by Jennifer Corbin Carson. Each week, we dive into hot topics and essential resources for individuals, businesses, veterans, and their families. Join us for insightful discussions and practical advice as we navigate the tides of change together. At Beach Jam Media, knowledge flows endlessly and insights never stop. Contact us to be a part of our show at our email address, beachjammedia@gmail.com.
You've been watching Beach Jam Media with Jennifer Corbin Carson. We invite you to jump back in and keep your feet wet with us as we continue to be your guide through the waves of change. Now let's dive back into the show.
Good morning. Again, glad you all are here with us today. Today we have another VA representative, and Dr. Nieka Jackson, and she is a VA pharmacist. And today we will recognize International Overdose Awareness Day, and that is August 31st. I know we're a little bit, it's 10 days away, but that is a day to remember loved ones who have died as a result of an overdose, and to encourage support of those who are recovering or want to recover or are impacted by substance abuse and overdose. So without further ado, I will introduce Dr. Nieka Jackson. Dr. Jackson, good morning.
Good morning. How are you?
Good. How are you?
I'm doing well, thank you.
Good. Good. Did I say your name right?
So it's Nieka, but it is a pretty hard name to pronounce. So no worries.
Sorry about that. Okay, so today, August 31st is International Overdose Awareness Day. And what is you're a pharmacist, right? So what is the number one thing that you see with veterans as far as the overdoses go?
Yes. So, the intention for celebrating Overdose Awareness Day, in our VA facility, we actually sort of celebrated the entire month of August. Even though the actual awareness day isn't until the 31st, we do several things within our facility to recognize leading up to this event. For us, the biggest thing is preventing overdose deaths or overdose related events. And this can include intentional or unintentional overdoses, because not always will an overdose be related to someone taking medications or some type of substance that may not be prescribed to them. But there have been cases where there have been accidental overdoses, including for veterans who may have family members or friends that live near them, or even the smallest thing that we may not always think of, like pets within their homes, especially if they're prescribed a high-risk medication. So our overall goal is to increase awareness and decrease stigma and expand knowledge to naloxone therapy, which is also known as Narcan. And that is the biggest emphasis that we put on this day. I will mention though, even though the awareness day isn't until the 31st, at our site, we will be recognizing the event on the 29th because the 31st does fall on a Saturday. So we usually have these events during the work week. So that way we're able to capture many of the veterans that may be walking through the facility. We'll have different booths set up at every places. And I can go more into detail of that whenever you're
That'd be
ready.
great. Yes, please. That's what we're
Yeah.
about, right? We're about getting all the information out. And if somebody needs to come and, to an event to help them with overdose awareness, I mean, that is what this is for, right? So yeah,
Yeah.
absolutely. Please do.
Yes. So on August 29th, that will be the day at the Carl Vinson VA Medical Center. We will have several booths on this display. Not only will these booths be available at the main campus in Dublin, we will have booths available at several of our outpatient clinics. So some of these clinics include the Perry Outpatient Clinic, Macon, Tifton, and the Albany Clinic, as well as Perry. I almost forgot about Perry. So we're gonna have a table set up at all of these places. And at the table, there will be several clinical pharmacist practitioners, such as myself, there available, giving out different handouts and information about overdose risk and naloxone. Veterans will also have the opportunity to be prescribed a naloxone kit at the booth that day. So, it's not something they have to go to their primary care provider or any other team members for. And the best thing about it is it's free of charge. So there's
Wow.
no charge for a naloxone kit. Yes. And veterans do not have to have a prescription for an opioid, because that is one of the other misconceptions. A lot of veterans think they need to be prescribed an opioid prescription to receive a naloxone kit, and that's not necessarily true. Any veteran can get a naloxone kit free of charge from the VA.
Wow, that's amazing. See, I learn something new every time I have somebody on, and that's fantastic. So they can get it for somebody that they think needs it,
Mhm.
or if they're on illicit drugs, then is that the purpose of? I guess what I'm getting at is what is the story behind them not having a prescription for it?
Okay, yeah. So, I guess to give you more background, like in Georgia, if you look at the Georgia Department statistics, there is an increase in overdose deaths of roughly about 60% between 2019 to 2021. And as we know, that's in the middle of the pandemic phase, lots of isolation, staying at home, increasing
Mhm.
risk abuse or purchasing illicit medications or drugs off the street, especially in our veterans that may have chronic pain conditions and may have difficulty getting their medications. In addition to that, there was also an observance of an increase in fentanyl distribution in
Uh,
these illicit ones. From 2019 to 2020, there was more than a 200% increase in fentanyl related overdose deaths. And that's a
uh,
large amount. 200% is huge. So, our goal, as you kind of got it before, naloxone is an opioid overdose medication. So it's
mhm.
something that we want to ensure all veterans have access to because it is a life-saving medication. Opioid overdoses are particularly tricky because they do sometimes present as if a person is sleeping. They may not always present as a medical emergency. And naloxone is one of the key factors at preventing a tragic event, because our major concern with an opioid overdose is opioids can slow the respiratory system down, ultimately where it can be fatal and the person can stop breathing, no oxygen gets to the body. And what naloxone does is it reverses the effects of the opioid by blocking those opioid receptors. And that's what is the life-saving key to naloxone.
Wow, that's fantastic.
Mhm.
I never now, I mean, you always hear the commercials on, on the opioid crisis and things like that, but that's good to know. And Narcan and things like that. But people never really get into the crux of it. What is this and how does it affect us? So I appreciate that explanation. I'm an ask why person.
Yes.
So it's good to know what it does. So I have now from the VA secretary. I was doing a little research, and the VA secretary said in 2019 that veterans are twice as likely to um, die from an accidental overdose versus the general U.S. population. So, do you have insight into that?
Yeah, just a little bit. The same information as you have as well about the that veterans being 2 times as likely to overdose. For instance, from 2010 to 2019, the veteran population overdose rates increased by more than 50%, and that's where they get that 2 times population number from. And they also saw that there was a 300% increase in those events being related to stimulant overdoses. So, stimulants and opioids being mixed together. And for those who may not know what stimulants are any type of medications or drugs that are similar to like cocaine, methamphetamine, or even prescription stimulants are things like Adderall, or Ritalin, medications that are used for ADHD. So, with the increase in illicit substances, we've seen that these stimulant illicits have also taken precedent in the market. And they are also being laced with fentanyl, which makes that combination very dangerous, especially for our veteran population. Sorry about that.
Oh, you're good. You're good.
So
And
having it puts our veterans at the highest risk for sure, especially since our veterans have several risk factors that could put them at risk for addiction.
well, and I'm sure that veterans, as well as the general U.S. population, there are a number of people who self-medicate with alcohol
Mm-hmm.
and the opioids. So mixing I mean, so I'm in Middle Georgia, right? And so we're about an hour north of you guys. So, but but you see those commercials all the time about family members and things like that. Now it's not just the veterans, it's the family members too,
Yeah.
that self-medicate with alcohol, and then they take an opioid with it, and that's dangerous as well.
Oh yeah, for sure. And when we talk about risk factors for an overdose, majority of these risk factors really correlate with our veteran population, as you mentioned earlier. So one biggest risk is, of course, alcohol use, any other co-occurring drug use disorders, such as if they have issues with cocaine use or marijuana. Marijuana is also, even though it may not always be thought of as a illicit substance, given some states have legalized marijuana in certain cases, but federally marijuana still remains a controlled substance. Marijuana is more recently becoming laced with other substances as well. So when that's combined with an
Mhm.
opioid, it makes it very dangerous. Other risk factors, especially for our veteran population, is if they have some sort of underlying mental health condition. So we know mental health disorders can correlate with the potential for opioid addiction, as well as if patients or veterans have any other underlying conditions, such as COPD, which is a condition of the lungs, or if a person has sleep apnea, where that's a condition where a person may stop breathing in the middle of the night while they're sleeping. Those medical conditions can put someone at risk for an opioid overdose, and that's where the unintentional overdose population comes into play. So we just have to be very careful, and we try to educate our veterans the most that we can, especially in terms of the stigma when it comes to addiction. We don't want our veterans to assume that just because they're a veteran, we think they're at risk for an overdose, and that's not always the case. But medical conditions is a huge risk factor, as well as medication combinations, as you mentioned, with alcohol, per se, or there's some medicines such as benzodiazepines is a group of medicines, like Xanax. Those are other things that slow breathing down. That in combination with an opioid can also, be very risky.
Right, and that's why we have you guys to tell us what those what dangerous combinations there are. And if you do have a question, if any of the veterans have a question about the medications that you're on, you can call the VA pharmacy, right? And ask to speak to a pharmacist and say, I have a question about this, or your local pharmacist. It's best to, wherever you're getting, and you can correct me if I'm wrong, but wherever you're getting your medications from, and they have a full list of the medications and your diagnoses, that the pharmacist can tell you, okay, well, this is not going to go with this, so we have to find something else, or this is a dangerous combination, so let's contact your doctor and get you on another something else that will work for you. So they look at and that's why it's really important. I feel it's really important to go to one pharmacy, or make sure, if you're going to more than one, make sure that they have the correct list of the current medications that you're on. Because if you go to different pharmacies, they're not linked. So unless they're within, like Ingalls or CVS, I'm not sure how CVS does it, but so I used to work at the pharmacy at Ingalls. So this is why I know that. But you can see if something's been filled at another pharmacy within the Ingalls system. So I don't know how the other pharmacies do it, but I'm assuming it's the same way. But yeah, you have to make sure that these are updated within every pharmacy that you go to, because they're not necessarily linked together. So it's important for the pharmacist to do their job correctly, that they have a current list of the medications that you're on, so you can avoid potential harmful what's the word I'm looking for? Not complications, but interactions.
Interactions, yeah.
Yep,
Yeah,
interactions between. Go ahead, sorry.
no, I was agreeing with you.
Yeah. Yeah, so I mean, it's important to have those current lists if you go to more than one, to avoid those interactions and avoid a possible overdose, because you can be taking more than one thing, like Dr. Jackson was just saying. You can take more than one thing that can be harmful. So
Yeah, that's
absolutely, yeah.
and we
So
take sorry not to cut you off. I was just saying we take that very seriously, and even if a veteran isn't able to get the answers they need by calling our VA pharmacy, if they are seeing a primary care provider with the VA or any clinician, we have clinical pharmacists such as myself who work outside of the pharmacy. We work in the primary care teams with their doctors. We can do thorough medication reviews, and we look at their disease states, and they can ask their provider, hey, can I speak to my clinical pharmacist on the team? to review my medications. And we definitely have more time dedicated to doing that in the clinic setting, because we know that our providers are busy and they see many patients per day, but each team has a clinical pharmacist practitioner available to them.
Wow, something else I learned. That's fantastic. Well, and that makes sense because it makes it more efficient, right? So, oh, that's fantastic. Okay, so so when, so I'm switching gears a little bit here.
Mhm.
So can you tell me the process? So I know a lot of veterans go to community care and or care in the community. I always get them mixed. I always say it wrong.
There's no wrong way. The way you said it, it's used interchangeably.
Perfect.
Yeah.
So can you tell, I'm not sure, I apologize to our listeners. I did not talk to Dr. Jackson before this. So and I don't mean to put you on the spot. Do you know the process on the community care network as far as the pharmacy goes? So if a community care provider says, okay, this is the medicine that I want you on, or you have orders, what is that process for them to get the medication prescription from them to the VA so it will be sent to the veteran?
Okay, yes. So typically, that there is a separate process for that, and I don't want to misspeak on the exact process, but the way that it typically works is if there's a medication that the community care provider wants the patient to take. So most of the time, the patients will bring that prescription to the VA pharmacy. We actually have a separate department within our pharmacy that handles that process of making sure that medication gets filled and sent to the patient. Um, there is a way for providers in community care to reach out as well to the VA pharmacy to make that happen. I just don't want to misspeak on that process exactly, since that's not my area of expertise within the pharmacy, since I work directly in the clinics. But I'm happy to get back with you guys to give you more information on that, so that way it's accurate. I don't, again, I don't want to give any incorrect details.
And I appreciate that. I really do. And sorry to put you on the spot.
No, no
So
worries. Had I known that was going to be a question, I definitely would have been prepared for you to tell you
oh,
who to call, how that process is laid out. But I can reassure you that that is something that happens really frequently, and all the time. And our pharmacy does a really great job at handling those requests. One thing I will mention though is some medications from community care may take a little longer depending on what the medication is that community care provider is requesting. For those who may not know, the VA has a built-in formulary where there's medications that are considered to be preferred, or that may be second line, or they may be non-formulary, meaning it's not on the VA's preferred list. And if it's a medicine that the provider in the community wants the veteran to take that's not on that list, the process may take a little longer. Sometimes we have to get more information from the community care provider to justify that medicine.
right. So I've been through this process myself, and I will tell our listeners that it is exactly like if you would go to your own insurer and say,
Mm-hmm.
because it's United Healthcare, right? That the VA goes through.
I'm not exactly sure if it's United Healthcare specifically that they go through. Well, VA has its own PBM is what we call it. So it's a pharmacy
Right.
benefit manager. So it's not a outside insurance per se. It's actually a VA dedicated drug formulary. So when it goes through that non-formulary process, there's another pharmacist that reviews the actual national criteria for that drug that the provider is requesting. And then if there's more information needed, a lot of times we will have to send that form to the outside provider and request that they fill out information about, you know, if the veteran has met the criteria to get the special medicine. But I will mention this is the similar process to private insurance. If a veteran has ever had private insurance, let's say with Shield or United Healthcare or any other covering provider, those insurance companies go through the same process with CVS, Walgreens, and all the other types of retail pharmacies. The beauty of the VA, though, all of the things that we have is handled internally.
Yes, so it's very similar to your private insurance, the formularies and things like that. So, well, Dr. Nieka Jackson, thank you so much for being with us today and being put on the spot. We appreciate you and all the work that you're doing in your clinical setting. And thank you for all the information. I learned quite a bit today. So I hope to speak with you soon. And again, thank you so much for your time and the efforts, all your efforts this morning to get on with us.
No problem. I appreciate you guys having me here, and I'm happy to join any other time. If you guys want more information about other topics or initiatives, I'm very happy to share.
That's great. I will be contacting you, definitely.
Okay, sounds good.
We will, we will see you. So I'll talk with you soon. Okay, thank you. Bye. So that was Dr. Nieka Jackson. She's a VA pharmacist in Dublin, Georgia. And so this, what she was talking about is a nationwide opioid crisis that we are going through and celebrating International Overdose Awareness Day. So make sure you check out those dates at that they're having within Georgia. And if you're not in Georgia, then maybe the VA in your area is having events as well for this day, which is August 31st. But like she said, they do it all, they promote it all month long. So, and if you're, if you are, if you need the veterans, thank you, my production team. If you need the Veterans Crisis Hotline, there it is. You dial 988, then press 1. I encourage you to use it if you even think you need it. Call them and they will help you out. So thanks again for being here. Next week, we will have an announcement and you'll have to stay tuned for that one. So thanks again for being here and we will see you next week at the beach.
In the calm of early morning, when the day begins anew, we pause to reflect. May holds a special significance beyond just being another month. It is time for solemn remembrance, gratitude, and honoring those who've made tremendous sacrifice for our freedom. To all who served in the military, across all branches, and the National Guard, to the veterans, and to the families who support them through thick and thin, we express our heartfelt thanks. Your courage, sacrifice, and unwavering dedication inspired us deeply. As we commemorate Military Appreciation Month, we recognize the importance of standing by our newest recruits. Those brave individuals venturing into an unknown, responding to duties called with determination, deserve our utmost respect and guidance. Equally important is our commitment to support those actively serving in the Air Force, Coast Guard, Army, Navy, Marines, Space Force, and National Guard. Whether deployed abroad or stationed at home, they carry out their duties with honor and integrity. It is our responsibility to ensure they have the resources, care, and unwavering support necessary to fulfill their missions. So, as we observe Military Appreciation Month, let's unite in gratitude and solidarity. Let's honor the past, support the present, and inspire the future. To all who serve, have served, and those who stand beside them, we extend our deepest appreciation. Happy Military Appreciation Month.
Thank you for tuning in to Beach Jam Media with your host, Jennifer Corbin Carson. We hope today's dive into hot topics and valuable resources left you feeling refreshed and inspired. Our mission is to keep you informed and engaged as we ride the waves of what washes up in life together. Until next time, stay curious, keep the conversation flowing, ask questions, and let the glisten of the shoreline guide your journey. Goodbye.